This is Dr. Narendrakumar from Chennai. We'll be explaining the nasal Synechiae release. The patient had nasal obstruction present to us with on examination. The left nasal cavity has a large Synechiae. The right nasal cavity have multiple Synechiaes. We started the surgery under local anesthesia by giving infiltration on both sides of the Synechiae. So the post-operative care after any nasal surgery is very important, or else the formation of the Synechiae occurs, which gives nasal block even after the surgery. So just by using a simple technique, this is a through cut nasal forceps, just making it, that's it. A small cut at the middle of the Synechiae, which gives an immense result, and you can't able to find out any chances of recurrence after this, because it removes the tissues in between and makes a very clear cut, a single cut. To avoid the recurrence of the Synechiae, we are placing a reshaped X-ray sheet. This can be done by using a silastic sheets too. This is on left nasal cavity, and we are placing one more sheet over the right nasal cavity for the same, and we have to fix it using cool suturing. And the needle comes out here. It will be a little tough, but make sure both the sheets are included. Little more pressure, it comes on the opposite nasal cavity, and that's it. So using a cool suturing, one more suture over the vestibule, this will make both the X-ray sheets in situ to retain for a week, which completely prevents the recurrence. And that's it. Very simple technique. Hope you have enjoyed. Thank you one and all for watching this video. Thank you.